Imagine paying like thousands of dollars out of pocket for a highly specialized medical procedure,
Right.
and you endure the physical discomfort of the treatment only to completely erase its benefits and potentially even scar yourself just by using a single dry cotton cylinder.
It sounds wild, but honestly, it happens all the time. The aesthetic industry really loves to market these as lunchtime procedures.
Exactly. The implication is just total convenience. You walk into a clinic on your lunch break, you get something zapped or smoothed out, and you walk right back into your afternoon meeting like literally nothing ever happened.
But when you actually look at the post-treatment medical instructions for, say, non-surgical vaginal rejuvenation, that whole lunchtime narrative completely shatters.
It really does. Because your body isn't just bouncing back, it is operating as an active, microscopic construction zone.
Yeah, the marketing label of no downtime heavily masks the intense biological tissue repair that the body is, well, forced to undertake. These procedures demand a massive physiological response.
Welcome to the Deep Dive. Today, we are taking you into the reality of laser and radiofrequency vaginal tightening.
Which is a topic a lot of people are curious about right now.
Absolutely. We know many of you listening are exploring these treatments for postpartum recovery or, navigating the really frustrating and often painful symptoms of menopause.
Right, and our mission today is highly focused.
Very focused. We are taking clinical guidelines, medical studies, and actual post-care instruction sheets from practices across the globe to answer one surprisingly critical, highly practical question.
And that question is, can you use tampons after laser or RF tightening?
Such a specific thing, right?
Yeah.
But the answer to that one specific question actually unlocks the entire story of what these devices are doing to the human body on a cellular level.
It really does. It completely reveals the gap between, aesthetic marketing and biological reality.
So before we can even talk about tampons, we really have to understand what the treatment itself just did to the tissue.
Right, because you go in, you lie back, and a doctor uses a device. Maybe it's a fractional CO2 laser, an erbium YAG laser, or a radiofrequency wand.
And to put it simply, these devices are intentionally causing microscopic damage.
Exactly. The clinical term for this is controlled thermal injury.
Controlled thermal injury. So if you look at a fractional CO2 laser, for instance, it delivers these tiny, precise columns of light energy directly into the vaginal wall.
Yeah, and we are talking about penetrating just about 0.5 millimeters deep.
Which sounds incredibly shallow. I mean, half a millimeter.
It does sound shallow, yeah. But at a cellular level, you are essentially vaporizing tiny fractions of tissue.
Wow. And radiofrequency devices operate on a similar principle, right?
They do, though they use targeted heat energy instead of light to reach the underlying tissue layers.
Okay, so it's a different energy source.
Right. They might not ablate or vaporize the surface layer in the exact same way a CO2 laser does, but the physiological goal is identical. You are creating a trauma response.
I always think of this mechanism like aerating a lawn.
Oh, that's a good analogy.
Yeah, because if you have a patch of grass that's dry, compacted, and just not thriving, watering it more doesn't really solve the root issue.
No, the water just sits on top.
Right. So you take that machine with the heavy metal spikes and you intentionally punch hundreds of tiny holes into the dirt.
You damage the lawn on purpose.
Exactly. And because you created that damage, the soil opens up, nutrients rush in, and the grass is forced to grow back thicker and greener just to repair the trauma.
And the body operates exactly like the lawn in this scenario. Creating those microscopic thermal injuries in the vaginal wall triggers the body's emergency repair system into high gear.
A massive healing cascade begins immediately.
Right. Biological cells, fibroblasts, rush to the site of those vaporized columns.
And fibroblasts are kind of like the architects of your skin, right?
Yes, exactly. They act as the architects of your skin and connective tissue. They synthesize new collagen and elastin, and they even stimulate new blood vessel formation.
And the clinical texts referred to this process as neocollagenesis. I love that word.
It's a great word. The body is literally rebuilding the vaginal lining from scratch.
So the stratified squamous epithelium, which is just the scientific name for that tissue layer, it actually starts to become physically thicker.
And as it thickens, it starts producing more glycogen, which is critical because it feeds the good bacteria, the lactobacilli.
So the entire local ecosystem is being remodeled.
Remodeled from the ground up. But, and this is the key part, while this remodeling is happening, the tissue is in a highly vulnerable, fragile, transitional state.
Right. Which brings us back to the tampon question. Introducing a dry, abrasive foreign object into a delicate, microscopic construction zone,
Completely disrupts that transitional state.
which gives us the definitive answer found across every single clinical protocol we reviewed.
The answer is an absolute no,
No tampons. You cannot use tampons immediately after this treatment.
period. But the exact timeline of when you can safely use them again varies wildly depending on which clinic's guidelines you actually read.
Oh, it really does. I was looking at Priston Care and the Rocky Mountain Laser College, and they both advise waiting at least 3 days.
Okay, 3 days.
But then the Women's Health Clinic recommends avoiding them for 5 to 7 days.
That's quite a jump.
And then you have Dr. Hala's clinic in London and Modern Women's Health in Texas, and they're drawing a hard line at a full 7 days. Some even push it further.
Right.
So I was looking at this wide range from 3 to 7 days and trying to figure out, are these clinics just guessing, or is there an actual structural medical reason for this discrepancy?
Well, the timeline depends heavily on biological variables and the specific technology utilized.
Okay, makes sense.
Like an erbium YAG laser, for instance, might cause a different type of thermal footprint than a fractional CO2 laser.
So the tool matters.
The tool definitely matters. Furthermore, the intensity or power settings chosen by the doctor, combined with an individual patient's baseline healing speed, dictate how fast that mucosal layer regenerates.
So everyone is a little different. But the universal consensus across all these varying timelines is that you must wait until those micro-injuries have completely closed.
Exactly. If you introduce a tampon before those 0.5 millimeter wounds are fully sealed, the consequences are actively destructive.
Let's get into the mechanics of that danger, because it's not just about standard toxic shock syndrome.
No, it's not. We are talking about two primary localized threats: infection and friction.
Infection makes sense because the laser has essentially opened up the protective barrier of the vaginal wall, right?
So the area is highly susceptible to bacterial imbalance. A tampon acts as a bridge, introducing bacteria directly into those unhealed microwounds.
Wow. And the friction aspect is equally severe. I was reading the guidelines from Dr. Hala's clinic, and they explicitly warn that inserting any foreign object can cause the vaginal walls to rub together.
Yeah, and it rubs together in a way that mechanically shears off the recently treated skin.
Shears it off.
Yeah.
Just think about the physical nature of a tampon. It is designed specifically to be highly absorbent. It is dry cotton.
Very dry.
So when you insert and remove a dry, abrasive object against tissue that has just been microscopically burned tissue that is actively trying to regenerate a delicate new layer of cells.
You are mechanically scraping off the very collagen and elastin your body is working so hard to build.
It's crazy. It's like applying a highly expensive medical-grade chemical peel to your face
Yeah.
and then aggressively scrubbing your face with a dry, coarse towel an hour later.
That sounds incredibly painful.
You are literally rubbing away the benefit of the procedure. You're throwing thousands of dollars away, and you're actively inviting scarring.
You risk severe irritation, delayed healing, and ultimately a complete loss of the treatment's therapeutic benefits.
So practically speaking for you, the listener, this creates a major scheduling hurdle.
It really does.
What if your period arrives the day after your appointment?
Well, multiple clinical guidelines, including those from Dr. Hala and the Rocky Mountain Laser College, highlight a very specific scheduling strategy to avoid this exact scenario.
Right. They strongly advise booking your laser treatment, specifically after your menstrual cycle has completely ended.
Yes. You want to engineer your calendar so you aren't even put in a position to choose between a tampon and a pad during that critical 1-week healing window.
Don't leave it to chance. Book it for day 7 or 8 of your cycle.
Exactly. But managing the menstrual cycle is really just one component. The tampon prohibition belongs to a much broader, incredibly strict post-care ecosystem.
Right. An ecosystem designed to protect a very fragile environment.
Because if friction and bacteria are the enemy of this new cell growth, then it makes complete sense why the guidelines don't stop at tampons.
It completely explains the rest of the restrictions, like no sexual intercourse for anywhere from 3 to 14 days, depending on the clinic's assessment of the thermal depth,
That's a big one.
and no submerging in baths, hot tubs, or pools for at least 3 days.
Right, because standing water is a huge vector for bacteria, though standard showers are perfectly fine.
Right, showers are okay. And you're supposed to wear loose cotton underwear and avoid pantyhose to manage heat and moisture.
That makes sense.
But the one that really caught my eye was the ban on strenuous exercise, heavy lifting, or intense yoga for 3 to 5 days.
Oh, yeah. A lot of people are surprised by that one.
I was. Initially, I thought, why can't I lift weights? It's not a major pelvic surgery. But Pristine Care notes that heavy exercise causes sweating.
It's what can travel.
Exactly. Sweat can travel down to the vaginal area and alter the delicate pH balance while the tissue is trying to heal.
See, the pH of sweat is slightly acidic to neutral, but it is fundamentally different from the highly specific, ideal acidic pH of a healthy vaginal microbiome.
So it throws things off.
Completely. When the tissue barrier is compromised by the laser and the lactobacilli are trying to reestablish dominance in that newly forming glycogen layer, flooding the area with sweat acts as a massive disruptor. Even your own sweat becomes a potential irritant that can invite pathogenic bacteria to outcompete the good bacteria.
Okay, so if you are a patient following all these rules, no tampons, no baths, no spin class, what do you actually feel during this week of healing?
Well, it is essentially a localized burn, so the clinical sources outline very normal side effects.
Like what?
You might experience clear or slightly pink, watery discharge for a few days.
Which is just the tissue weeping as it repairs the thermal injuries.
Exactly. You'll likely feel mild swelling, some itching as the skin heals, and a sensation very similar to a sunburn.
The sunburn inside the body. That sounds so uncomfortable.
It is. To mitigate that sensation, clinics like North Coast Urology and Orange Coast Women's Medical Group recommend using cold gel packs.
Like 20 minutes on, 20 minutes off.
Yep. And keeping the external treated areas moist is highly recommended too.
So applying a barrier ointment like Aquaphor or Vaseline.
Yes, after gently washing with the hypoallergenic cleanser, it really soothes the healing tissue.
Okay, so I look at this list of temporary lifestyle disruptions. No tampons, no baths, no sex, no gym, icing your pelvic region, managing weeping tissue.
That's a lot.
It is a lot. And the multi-thousand-dollar question naturally arises. Is this underlying procedure actually proven to be worth all this effort?
Well, patient satisfaction surveys and short-term clinical trials show remarkably positive results.
Really?
Yeah. Clinics report a 70 to 80% improvement in vaginal tone.
That's huge.
And women experiencing severe genitourinary syndrome of menopause, which causes profound dryness, thinning tissue, and extremely painful sex, they're reporting dramatic relief.
The Cleveland Clinic and the Bangkok Hospital sources both highlight how this technology operates as a major game changer.
Especially for breast cancer survivors.
Right, or women who physically cannot take estrogen replacement therapy.
For them, a laser treatment that utilizes their body's own localized collagen production to restore moisture is an absolute lifeline.
Because the short-term studies, meaning follow-ups of up to about 1 year, show that the thermal injury successfully sickens the tissue, lowers the vaginal pH back to healthy premenopausal levels, and significantly reduces painful intercourse.
That's the short-term view, yes. But when we zoom out and look at the major global regulatory bodies, however, we see massive red flags being raised.
Massive red flags regarding long-term safety and the actual quality of the evidence supporting these devices, right?
Exactly. The medical community wants to know what happens at year 3 or year 5, not just month 3.
Which makes sense. In July 2018, the U.S. Food and Drug Administration issued a very stark safety communication.
They explicitly warned against deceptive vaginal rejuvenation claims.
Yes, they stated clearly that the safety and effectiveness of energy-based devices for these specific procedures have not been established.
And they noted adverse event reports, including severe pain, persistent dyspareunia, which means painful sex, and actual scarring of the vaginal canal.
Which is terrifying because that's exactly what some women are trying to cure.
Right. And the Australian TGA, their equivalent of the FDA, went even further in their post-market review.
I saw this. They didn't just issue a warning, did they?
No, they literally canceled the registry of all energy-based devices intended for vaginal rejuvenation.
Wait, all of them?
Every single one. Devices like Syneron Candela, Mona Lisa Touch, FemiLift.
Oh, wow.
Yeah, their makers either withdrew them or the TGA canceled them because they found insufficient clinical evidence to support the therapeutic use and long-term safety.
And in the UK, the NICE Guidelines, the National Institute for Health and Care Excellence, published an overview stating that transvaginal laser therapy lacks robust, long-term efficacy data.
So as a result, it is not available on the NHS.
It's a fascinating, almost whiplash-inducing disconnect for the listener.
It really is.
On one hand, private clinics and short-term studies publish glowing reports of rapid symptom relief from women who say the treatment gave them their intimacy back.
And on the exact same treatments, global health authorities are slamming the brakes, pointing to reports of burns and scarring, and demanding multi-year data.
This highlights a structural dilemma in modern medicine, doesn't it? Particularly in the realm of medical devices and quality of life treatments.
Absolutely. The rollout of new technology often outpaces the long-term, randomized, double-blind clinical trials required by strict regulatory bodies.
Because conducting a 5-year, double-blind study on a laser device is incredibly difficult and expensive.
And for a patient suffering from severe menopausal symptoms today, waiting 5 years for a definitive study isn't helpful.
Not at all.
But for regulators, allowing a device to remain on the market without that 5-year safety data is a dereliction of duty.
This regulatory caution underscores exactly why adhering to those strict post-care rules is absolutely non-negotiable.
100%.
If you are undertaking a procedure that inherently carries clinical uncertainty and lacks multi-year safety data, the last thing you want to do is introduce a preventable variable.
Like a tampon or standing bathwater.
Right. That could trigger an infection or cause the exact scarring the FDA is warning about. You cannot cut corners on the healing process.
The body always keeps the score, and cellular repair always requires time and biological respect.
So, to recap the core mechanics we've pulled from this deep dive, if you opt for laser or RF vaginal tightening, you must respect the biological healing window.
The device creates microscopic thermal injuries.
And your body responds by rushing in fibroblasts to build new collagen and elastin. To let that happen without interference, plan your calendar carefully.
Book the procedure right after your period ends.
Do not use tampons. Do not submerge in baths, and skip the heavy workouts for at least a week, or whatever specific timeline your individual doctor prescribes.
Treat the area as if it is actively recovering from a burn, because scientifically it is.
But looking at this entire landscape, the glowing short-term clinical reports contrasting with the severe FDA and TGA warnings, it really leaves us with a much broader issue to ponder.
It does. Women navigating menopause, postpartum recovery, or recovering from breast cancer treatments are frequently left undersupported by traditional medical avenues.
Conditions like severe vaginal dryness or painful sex are often dismissed or just under-researched.
And because traditional medicine hasn't provided enough accessible long-term solutions, patients are practically forced into the largely unregulated, out-of-pocket aesthetic industry to find relief.
Right. And by entering that space where complex thermal injuries are marketed as breezy lunchtime procedures, the patient is forced to become their own medical risk manager.
Weighing the immediate relief of their symptoms against the lack of long-term safety data.
It's a huge burden. Thank you for joining us on this deep dive. As always, remember that while we love unpacking the science and synthesizing the sources, you should always consult with a board-certified specialist before making medical decisions.
Absolutely.
Until next time, respect the biological construction zone, skip the tampons, and we'll catch you on the next deep dive.